We talk a lot about end-tidal CO2 like it is just a number on the monitor, but it's really a reflection of some beautiful physiology. End-tidal is the partial pressure of carbon dioxide at the end of an exhalation. So for that number to even show up, CO2 has to be produced at the cellular level, carried through the blood, and exchanged in the lungs and then exhaled. That's why it's so powerful, because it connects metabolism, perfusion, and ventilation all in one value. Why wouldn't you want to use it, right? From a physiological standpoint, end-tidal is closely tied to cardiac output. If blood flow to the lungs drops, less CO2 gets delivered to the alveoli and your end-tidal falls. That's why in low flow states like shock or cardiac arrest, you'll see low numbers. On the flip side, if ventilation decreases, CO2 can't be blown off effectively, so end-tidal rises. And then if metabolism increases, like in fever, agitation, you're producing more CO2, which can also push that number up. So when you look at end-tidal, you're really looking at the balance between CO2 production, transport, and elimination. That's also why it's useful in cardiac arrest. During CPR, end-tidal gives you kind of that rough idea of perfusion, and in sudden increases of your end-tidal, that can be one of your earliest indicators for ROSC, because now you actually have circulation delivering CO2 back to the lungs. And then there's airway conformation, of course. Consistent end-tidal CO2 waveforms means gas exchange is happening in the lungs, which makes it the gold standard. We've all heard that for tube conformation and placement. But the biggest thing is end-tidal is and isn't just a number. It's a reflection of a system, and that number only makes sense if you interpret it in the context of what the body is doing, what your assessment looks like, what your patient looks like, all that. Because end-tidal works not because it just tells you a number, but because it tells you how multiple systems are interacting in real time. So this is my PSA for the day. Go use your end-tidal.